Greater Hyderabad Municipal Corporation or GHMC, the network of Basti Dawakhanas spread throughout the area is today the one-stop center that inspires trust and provides solutions to all health-related challenges for people living in slums and below the poverty line. Almost a quarter of the population of Hyderabad comes for medical advice and treatment to these Basti Dawakhanas, which have been built around the slum areas.
Yes.
50-year-old Sugun Amma has been suffering from diabetes for the last 10 years. Earlier, she would have to travel a long distance to get to the hospital from where she lives in Budwell, Rajendra Nagar. Getting to the hospital was not the only part of the story. There was also a long wait there to see the doctor. But with the Dawakhana or dispensary opening in her neighborhood, that struggle for medical attention is a thing of the past.
10 సంవత్సరాలు షుగర్ వచ్చి సెంటర్ దవాఖానలో చూపెట్టుకున్నా. ఆ దూరం ఉందని నేను పోతలేను, దగ్గర ఉందని ఇక్కడ వస్తున్నా. మెడిసిన్స్ ఇస్తారు, మందులు మంచిగా వాడుతూ इस्तरो वाड़कूटना मंचिना उंटुन्ना.
अभी सब खाने के बाद ही लिखा मैंने आपको. अगर इसके बाद कुछ और होता है तो अकॉर्डिंग टू योर ट्रीटमेंट, मतलब आपका रिजल्ट जैसा भी अभी जो मेडिकेशन दिए हैं इसके हिसाब से ट्रीटमेंट चेंज करना. अगर इससे अच्छा हो गया तो फिर नहीं चेंज करना. ठीक है.
As people's faith and confidence in the Basti Dawakhanas increases, so do the crowds. About 45,000 patients visit Basti Dawakhanas every day. Some patients are new, some come for follow-up visits, and some long-standing patients of diabetes and high blood pressure come to collect their medicine.
Basti Dawakhana concept is a very good concept. Initially, to start with, we also visited Delhi where Mohalla clinics were existing, and along with Commissioner Family Welfare, 2-3 DMNH was visited there. And it is a very good concept that the hospital is located right in the center of a slum, where people can utilize the health services at their doorstep. Because if you can see here, it is a very thick slum. We're surrounded by a lot of houses, and people can come to the doctor at their doorstep. They can utilize the OP services.
Those who would be at the mercy of fake doctors are today being treated by qualified MBBS doctors and trained nurses. Sangeeta Jaiswal is a school teacher in this area. She teaches the children here and also gets medical treatment done from here.
The same medicines continue.
आपके पास आए वक्त से अच्छा हुआ डॉक्टर. छोटा कुछ भी है तो ले रहे, कम हो जा रहा हमारे. हम प्राइवेट जाना छोड़ दिए, इधर ही चाहते आपके पास.
अभी पैर का दर्द कैसा है?
कम है मैडम. आप ट्यूब दिए ना, वो भी कम हो लगा है. टैबलेट्स भी आप दिए, वो यूज कर.
तो आँखों के वजन के लिए मैं ये एक लिख देती हूँ.
The system of Basti Dawakhanas was inaugurated on April 6, 2018, with 17 Basti Dawakhanas opening their doors on the day. Harassed, troubled, poor people in need of medical attention started thronging the dispensaries. By month end, there were 25 Basti Dawakhanas, with more being opened the next year.
Usually the Basti Dawakhanas would be located in urban slum areas. We actually check either the population is around 2000 plus, and it should be around a radius of 2 kilometers away from the urban primary health centers or the PHCs. And basically we choose the community halls which have been allotted by Greater Hyderabad Municipal Corporations. And in collaboration with Greater Hyderabad Municipal Corporation, we take the community halls and we procure the logistics and we take the HR from the district medical and health officer support, and simultaneously we interact with the TSMS IDZ to help us to positionize this Basti Dawakhana in the community hall based on the requirement of the local people.
Starting a Basti Dawakhana takes about 12 to 15 lakh rupees in establishing the necessary infrastructure. Each dispensary has an MBBS doctor, a nurse and an attendant. The salary of these contract employees comes to rupees 1 lakh per month.
ये 2 टाइम ले लो, ये गर्म पानी में मिला के पीना।
Currently, there are more than 250 Basti Dawakhanas in operation, with more to open soon. This is because, as per an estimate, 23% of Hyderabad's population lives in urban slums.
కానీ బస్తీ దవాఖాన మందులు అయితే మంచిగా ఇస్తారు సార్. నాకు షుగర్ ఉంది, బీపీ ఉంది, హార్ట్ అటాక్ ఉంది, స్టెంట్ చేసిండ్రు.
These are laborers from across the country who travel to Hyderabad knowing they will find work here, and others employed in small work who make their home in these 1,325 notified and roughly 100 unnotified slums.
हैदराबाद में बड़े बड़े हॉस्पिटल लाइक गांधी, उस्मानिया, फीवर हॉस्पिटल, वहाँ पर हर दिन 4,000-5,000 ओपी रहते थे. अभी 400-500 हो गया. तो सीरियस प्रॉब्लम है वही सुपर स्पेशलिटी हॉस्पिटल में आ रहे. जो बुखार है, सर्दी है, छोटे छोटे वहाँ बस्ती दवाखाने में जा रहे हैं. वहीं पर उनके बस्ती में ही उनका सुस्ती हो जा रहा है. वहाँ बस्ती में डॉक्टर साहब हैं. वहाँ पर पूरे हम टी डायग्नोस्टिक्स बोल के एक नया प्रोग्राम लाए. उसमें 56 वेराइटीज़ ऑफ ब्लड टेस्ट विल बी डन फ्री ऑफ कॉस्ट. वो 56 वेराइटीज़ का ब्लड टेस्ट करके ब्लड टेस्ट का रिजल्ट पेशेंट के मोबाइल पे भेजते हैं, हम डॉक्टर का मोबाइल पे भी भेजते हैं. आप सर्टिफिकेट के लिए फिर हॉस्पिटल आने की ज़रूरत भी नहीं है, मोबाइल पे ही भेज देते, ऑटोमेटिक चले जाएगा. सो उसके ऊपर डॉक्टर साहब प्रिस्क्रिप्शन करके उन लोगों को जो मेडिसिन है फ्री में बस्ती दवाखाना में देते हैं.
Educated in some of Telangana's leading colleges, the doctors serving in the Basti Dawakhanas may be young, but the experience they are gaining is unparalleled.
ప్లస్ హార్ట్ వచ్చేసి 60%లా 24% కొట్టుకుంటుందని చెప్పారు. ఇమ్మీడియట్గా మళ్ళీ వాళ్ళు టెస్ట్లన్నీ చేసేసి మళ్ళీ ట్యాబ్లెట్స్ ఇచ్చేస్తే వాళ్ళకి 1 వీక్ సార్.
39-year-old Hari Babu has come for a follow-up to this Basti Dawakhana in Rangareddy district. Though it was a heart disease, the symptoms presented as a regular cough and fever. But Dr. Vineet Kumar picked up on it immediately.
4 कदम भी नहीं डाल सक रहा था मैं. इतना 1 वीक में मैं 2 फ्लोर चढ़ सक रहा हूँ, उधर सक रहा हूँ. ये सांस में नहीं लिया मैं. ऐसा चल रहा था मेरे को. सर के पास आया, सर एक्सरे देख के ही मुझे भिजा दिया. अरे बिल्कुल नॉर्मल. अभी मैं गाड़ी पे आया, चला लेते हैं.
I diagnosed in my way of knowledge, and I diagnosed as a cardiomegaly. So I can see the big heart size has been increased, and immediately I'm advised him to take 2D echo right now. In 2D echo, his heart EF was only 24, very reduced, and reduced capacity heart, everything is reduced. I told him to go Usmania or whatever the emergency service you will get right now immediately, so that he can get a cure.
ఫైబర్ ఫుడ్స్ ఎక్కువ తీసుకోవాలి. బీపీ టాబ్లెట్స్ వేసుకోవడం వల్ల గ్యాస్ అనేది కూడా ఇంక్రీజ్ అవుతుంది.
Similarly, at the Basti Dawakhana in TRT quarters, Gandhinagar, we met Dr. Mansa, who left Hyderabad after marriage to live with her software engineer husband in San Francisco, USA. But the Basti Dawakhanas, started by the Telangana government for the poor and needy, brought Dr. Mansa back from America to Hyderabad. She explained the situation to her husband and brought her child back with her to start this social service, all while she could have earned lakhs of rupees every month in America.
I was inspired by my father. He's a economics department professor in Usman University. So he had inculcated such values in us so that we need to serve the needy. So I thought India is having more need of the doctors. So I just came here and joined in BD because we can give the free service to the patients here with our knowledge. So I'm inculcating the knowledge from the US, the treatment from there, and also here we are able to give the treatment to the patients. He's a software engineer, but even then he has understood my goal to service the patients. So he had come along with me. Good morning, madam. So I'm presenting the case of H. Nagaraj. He's BP and he's also a diabetic patient.
Dr. Mansa is consulting with a senior doctor via teleconferencing for advice on how to treat 65-year-old Nagaraj, who is not responding to the existing medication as the doctors had hoped.
Because I had a little bit of chest pain because of gastric problem. As I was taking some PAN 40 or something like indigestion. So I consulted the doctor in the Basti Dawakhana. She advised me to consult the superiors in the teleconference doctor. So I came over here. So she has given me good advice. She made a contact with the doctor and she gave some advice for me to doctor. She gave me some prescription that I have to follow. So that will be a better way if I follow it.
Are you satisfied now?
Yes, I am satisfied.
If a consultation and medical advice from a specialist doctor via teleconference doesn't work either, patients are referred from the Basti Dawakhanas to larger hospitals. Once referred, patients don't have to worry about waiting a long time to see a doctor.
We are referring the cases to the Nilofer Pediatric Hospital is there, MNJ Cancer Hospital is there, Usmania General Hospital is there, and also IMH is also there, and Chest Hospital are there. And she will write the referral and she will inform our doctor, our doctor. So that they will take care of the patient and they will check on priority basis, they will check there in the hospital. And again, they will give information to us also.
These narrow lanes contain within them a wide array of illness and disease, and the people living here fall prey quite easily due to a lack of awareness and understanding. In such circumstances, the equation between patient and doctor can help in identifying the disease.
They come directly to the OPD. I see them. If at all, if anybody needs any higher, super specialty advice, then we go for teleconsultations. If in the teleconsultation, if the doctor says that she needs to see the super specialty doctor, then we refer her to the higher tertiary care center. If there is any emergency, we provide ambulance. If the patient is in a stable condition, can go by himself or herself, then we refer them.
Like Urban Primary Health Center, now Basti Dawakhana has also been linked with Telangana Diagnostic, due to which common people are getting a lot of help. With the Basti Dawakhanas now connected to Telangana Diagnostic, there is further relief for the patients. Tests that would earlier cost anywhere between Rs 200 and Rs 2000 can now be done free of cost at the Basti Dawakhanas. There is a sample collection underway here.
और इधर टेस्ट भी करते, शुगर टेस्ट, थायराइड टेस्ट, CBP, हर किस्म के टेस्ट होते और रिपोर्ट्स भी नेक्स्ट डे आ जाते. वो रिपोर्ट्स में कुछ प्रॉब्लम है तो कंसल्टेंसी भी है हमारे यहाँ हॉस्पिटल में. तो कंसल्टेंसी थ्रू आपके जो प्रॉब्लम है वो डॉक्टर से आपको बात कराने लगाते हैं, हम लोगों को बात कराने लगाते जो प्रॉब्लम है. अगर यहाँ ट्रीटमेंट नहीं मिला तो हाई अथॉरिटीज़ हाई डॉक्टर्स कन भी जाते, जैसा कि उस्मानिया, गांधी, गोलकुंडा, उधर भी जाके वो ट्रीटमेंट देने लगाते।
The samples collected from the Basti Dawakhanas are sent to the sub-collection center and then from there to the Telangana Diagnostic Center. Telangana Diagnostic Center, also known as T-Diagnostic, starts receiving samples in the afternoon. The barcodes of the samples are scanned and tested, and then the samples are just put into an automated process where the mechanized system will analyze them in great detail.
हर एक रिपोर्ट के लिए टाइम लगेगा between 6 to 8 hours to 12 hours. The time what we have given it before that, the sample we receive at our center. Suppose if we are receiving at about 4 o'clock, means the sample report will be issued by the next day morning by 24 hours. In case of emergency from other hospitals, we will definitely inform the patient's report also. Even in the middle of the night, our technicians are there. If the dengue season is there, we are informing the patient in the night time also, because that is the ELISA is done in the night only. It is not because collectively we are getting in each tray, we can do about 100 samples. No comparison in the rates. Depends upon the type of the lab. But what we are doing, we are totally doing free. We are not asking any single naya paisa of the patient.
Every day, about 8,000 samples are brought here for testing. After they have been tested, an organization disposes of this contaminated biomedical waste in a scientific way. The Basti Dawakhanas provide many facilities that include OPD, diagnostic tests, free medical advice and medicine, immunization, maternal and infant care, family planning, anemia, raising awareness about diseases like blood pressure, blood sugar and cancer. The Telangana government's network of Basti Dawakhanas is now making its mark in almost every district apart from Hyderabad. Their presence can be seen in every district outside Hyderabad as well. 40 more Basti Dawakhanas have been added in the districts, taking the number of these dispensaries up to 299. Some more Basti Dawakhanas will be opened in the district soon, and that raises the question: where will such a large number of doctors come from?
As such, now we don't have any berth for the medical officers. We have enough number, and there is a list in each and every district. They are waiting for the postings. So I don't think there will be any less number, I think.
Adding to the primary urban health centers and Basti Dawakhanas, Telangana's ambulance service is bringing about a ground change in the health and well-being of the people of its cities and villages. The presence of a doctor, medicine and an ambulance service free of cost and just few steps away from home is nothing short of a boon for the villagers and economically weaker sections in Telangana. Chief Minister K. Chandrasekhar Rao is leaving no stone unturned to fulfill his dream of a healthy Telangana. It is that dream to which his government is dedicated.